So before I go in the patient's room to extubate them, I'll receive the order from the physician and make sure I verify it. Then I will talk to the nurse and communicate my intentions so they know what I'm going to do. Then I can gather all of my equipment. I will need a suction catheter, a syringe, scissors to cut the tape, and a separate oxygen delivery device to put on them after I extubate them. Then I will enter the patient's room and maintain asepsis by washing my hands and putting on a pair of non-sterile gloves. And then, oh, these are backwards. Slight pause. Then I will inform the patient, hi, my name is Megan Doherty. I'm a respiratory therapy student, and I am going to extubate them. So then I will place the patient's bed in a semi-Fowler or full Fowler's position before I do that. And then I will complete a baseline assessment so I can auscultate and look at all their vitals and everything. And then I will hyperoxygenate the patient and suction the trachea if indicated. Then I will use this suction catheter and suction down around the cuff to try to get any secretions that have pooled up there so they don't aspirate when I extubate them. Then I can discard the suction catheter and hook up the Yanker suction catheter in case I need to use that after I extubate them. Now I'm going to deflate the cuff, and feel for any air movement around their mouth. I can also plug off the ET tube and feel around here to make sure. In this case, he is breathing, I can feel that, so I can re-inflate the cuff. Then I'm going to proceed with extubation. So I will cut the tape around the patient's ET tube. There's a lot of tape. Wow. Okay, there we go. Finally. Then I'm going to ask the patient to take a big deep breath in for me. While they do that, I'm going to deflate the cuff, have them cough, and then I will pull this out following their line of their anatomy. And then I will hook up the supplemental oxygen. In this case I have a nasal cannula. Hook that up, make sure that's attached to oxygen. And then after that I will encourage the patient to cough up any secretions they have, and I'm ready with my suction catheter if I need to do that too. Then I will reassess, so I will auscultate and look at their vital signs, make sure I note their respiratory pattern, and just look at their general appearance, make sure they're okay. Then on my way out, I will inform the nurse the time that I extubated them and how they tolerated everything. I will discard of my gloves and wash my hands. And then I can document everything in the chart, and after, in like the few hours after and everything, indicate if they need bronchial hygiene or any of the lung expansion therapies. Oh, that was rough.